Today we're going to talk about the autonomic nervous system. When I'm talking about the autonomic nervous system, what am I talking about? Well, I'm talking about the part of the nervous system that is automatically controlling things, right? The stuff that you don't have to think about in order to make it happen. You might ask, well, what kind of things are that? Well, it's definitely not my moving my hands around here, right? It takes messages from my brain to tell my hands to move, something that I have to think about. When we're talking about the autonomic nervous system, we're talking more about like your heartbeat. You don't have to think to make your heart beat, right? Breathing. Well, you can overcome it with the somatic nervous system. By the way, the somatic nervous system is the one that is under conscious control. So breathing, we know that we can hold our breath, right? We can breathe real fast if we want, right? We can do that, but the autonomic nervous system will take over if we don't do what we're supposed to do. And actually, we don't want to have to think about breathing all the time. So the autonomic nervous system controls that, even though we do have somatic ability to override it to a certain extent. Digesting our food, right? I eat a steak, I don't have to think about what I got to do to digest it, right? There's two branches of the autonomic nervous system. That is the sympathetic and the parasympathetic nervous system, right? The sympathetic nervous system, the SNS, is the fight or flight, right? Hopefully everybody listening to this is aware of the fight or flight, and they've heard these terms before, because if you haven't, you're going to get kind of lost in this. So anyway, the fight or flight system, the sympathetic nervous system. That means if a scary ass bear comes through that door, I'm going to respond with the sympathetic nervous system, right? It scares me, right? I gotta run, right? What happens, right? My heart speeds up. We go through all these different things, right? All this stuff happens when that bear comes through the door and scares me. Unfortunately, it also happens when you're just kind of stressed over something that you're worried about, right? Maybe you're going on a first date with your girlfriend or something tonight, and you're kind of nervous about that. Well, your autonomic nervous system is kicking in, right? And it's doing all of these things that probably don't really need to be done, right? Same thing, you maybe got a big test tomorrow and you're studying for it and you don't feel like you're ready for it. And when you walk into that classroom, though, you're scared, right? And your heart rate beats faster and all that stuff, right? So that's the sympathetic nervous system. Then the other side of the autonomic nervous system is the parasympathetic nervous system. That's the rest and digest portion. When you are calm, things are taken care of. There is no danger. You're in a nice, safe area. Maybe your living room. You got your feet up. You're drinking a beer, watching TV. This parasympathetics now have kicked in, right? So now the parasympathetics are in control. Now remember, both of these systems, the sympathetic and the parasympathetic, they are both active all the time, right? One is more in control than the other, right? So you got them, and they're kind of in a tug of war back and forth. And that's important to remember it that way, because sometimes you might inhibit this side to strengthen this side, right? So if this side here is pulling over and you give something that inhibits it, boom, this side here takes off, right? So when one side goes down a little bit, the other side goes up, and vice versa, right? And they kind of maintain homeostasis that way, and they kind of keep you in a mode that is good for your survival. However, one or the other will take command when needed. So when you're in a rest and digest mode, then that's when you're kicked back, and the things are happening that allow the body to do the recovering, do the resting, right? Got food, it can digest it now, right? You don't want to do that when you're running from the bear. You want to rest, you want to do your digesting when you're sitting there watching TV, right? So that's just kind of common sense. So I'm going to kind of go through what happens, go head to toe and kind of go through the things that happen in our body when one or the other of these systems are activated. Before I talk about that, though, a couple of things that I want to make sure that you're aware of, because otherwise the whole thing is going to be pretty confusing to you, or you're not going to understand it. It's just going to be a lot harder to understand it. So So the things that I hope that you know, the definition of things that you understand. One is neurotransmitters. What are neurotransmitters? Neurotransmitters are a chemical messenger, right? They're released in the synapses between nerves and the effector organs. The effector organs are the organ that is being affected, right? Epinephrine will make your heart beat faster. Epinephrine is the neurotransmitter. The effector organ is the heart. Now, another thing to remember is hormones. Hormones are also chemical messengers, right? These neurotransmitters are chemical messengers produced and traveling across synapses. Hormones are chemical messengers that get out into the bloodstream and travel around to reach its effector organ. So it's released from an organ, right? We'll tell you the one that we're going to be talking about a lot here is adrenaline, right? Or epinephrine and norepinephrine. So epinephrine and norepinephrine are released from the adrenal medulla, travel through the bloodstream, and affect all of these different organs that we're going to be talking about when we talk about the sympathetics, right? So now we have talked about what the neurotransmitters are. We know what neurotransmitters are. And epinephrine, I might as well tell you right now, it's considered both a neurotransmitter because it's released in the synapses, and it's also considered a hormone because it's released by the adrenal medulla and travels through the bloodstream to go all over the body. So it does both of those things. Now we want to talk about receptors, because receptors is a big part of what I'm going to be talking about here in the next hour or however long it takes to do this video. Receptors are the area that receive the neurotransmitter, right? So we're talking about neurotransmitter. Well, it's going to carry impulses, right? It might carry impulses in a synapse from one nerve to the next nerve, or it might carry impulses from one nerve to the effector organ. And where that transmitter is received is the receptor, right? So when I talk about beta receptors, alpha receptors, stuff, that's what I'm talking about, right? A beta receptor is a beta adrenergic receptor is actually the right way to say it. That receptor is something that will receive beta adrenergic neurotransmitter, and the beta adrenergic neurotransmitter is it's epinephrine, or yeah, and I got to talk about a lot of stuff first here. You got your autonomic nervous system, ANS. You got your sympathetic nervous system, and you got your parasympathetic nervous system. Sometimes that'll just be PNS. I like to just put the whole thing there because PNS, people might get it mixed up with the peripheral nervous system. But so the parasympathetic nervous system and the sympathetic nervous system are the branches of the autonomic nervous system. In order for impulses from these areas to be carried out, to be transmitted, to produce an effect, you have to have a neurotransmitter, right? Let's talk about what neurotransmitters are. So you got to have one. Well, for the sympathetic nervous system, we have, I'm going to write the two words for it, adrenaline or epinephrine. Adrenaline or epinephrine, right? And I could put norepinephrine in here too. I don't bring up norepinephrine much. P-H-R-I-N. And the reason is because they do a lot of the same things. Norepinephrine works a little bit more on the blood vessels, right? The alpha receptors, which we'll talk about here in a minute. Whereas the epinephrine is more on the heart and the lungs and all that stuff. But there's a lot of crossover on what they do. So to simplify things, I just call it adrenaline or epinephrine, actually, because I don't talk about adrenaline much. I don't use that word. These are the same things, right? Both of them are the same thing. They do the same thing. It's the same thing. It's just two different words for the same thing. And one of them's Greek, one of them's Latin. I don't know which is which, but they're both for that neurotransmitter or hormone, because in this case that happens to be both. And adrenal means adrenal, on top of the kidney. Renal stands for kidney. Nephrin is also, nephro is also kidney, epinephrine on the kidney. So they're saying the same damn thing, they're just in two different languages. They just come from two different languages. Europe likes to use this one. We like to use this one. I like to make sure that I point this one out because for some reason we like to use epinephrine, that word, but we really like to use adrenergic receptors, which means receptors that respond to adrenaline, right? And we're using epinephrine. It's a little bit harder to make that connection because we use the word epinephrine and we're talking about adrenergic receptors. Well, they are receptors that respond to epinephrine, adrenergic receptors, right? Or adrenaline, because they're the same thing. So anyway, that is the neurotransmitter for the sympathetics. Now over here, I'm going to talk about this. The neurotransmitter for that is acetylcholine. Right? So acetylcholine, right? That's the neurotransmitter for the parasympathetics. Easy to remember there, right? And actually, acetylcholine, little side note, acetylcholine is also the neurotransmitter for the somatic nervous system. So it's acetylcholine that we use when I try to move my arms around, right? So I take my arm and I move it like that. Acetylcholine is a neurotransmitter needed to carry out that activity. Just to let you know, there's a drug called succinylcholine that we give to patients if we need to paralyze them. Let's say we need to breathe for them and we need to put a tube down and blow up the cuff in their bronchi and then start and put them on a vent. Well, people that are awake do not just lay there and open their mouth and wait for you to stick a tube down all the way to their lungs, right? You just can't do it. So paralyze them. We use succinylcholine, and what that does is it blocks all of the receptors for acetylcholine, which means they totally paralyze this person. They're still able to think, right? But they're not able to. They'll remember everything, but they're not able to move anything, not even their respiratory muscles. But since adrenaline is over here in the sympathetics, their heart can still go on, right? The things that have to go that way, but you're going to have to stick a tube in there and get them in order to breathe for them right away because you've just paralyzed their lungs and everything else. Let's see here. Now, what was I talking about here? Okay, another thing that I don't get into is that acetylcholine is used over here in the sympathetics for a few things. Some of the from the upper motor neuron to the lower motor neuron, some of those synapses acetylcholine is used. I'm not going to even talk about that though because it's not important for the discussion that we're having today, right? So I'm going to keep this as simple as possible. Neurotransmitter for the sympathetics, adrenaline or epinephrine. Neurotransmitter for the parasympathetics, acetylcholine, right? So that's the chemical messenger that will carry from nerve to nerve or nerve to effector organ. It's acetylcholine or epinephrine, depending on which one of these branches of the autonomic nervous system we're in. Now, an important thing to discuss here is the neuroreceptors. Right? I'm going to put a line down the middle here. Right? The receptors, right? The things that this neurotransmitter has, the thing that will accept that neurotransmitter in order to pass on, in order to be stimulated, right? So now we have to talk about the receptors. Receptors accept the neurotransmitter, epinephrine or acetylcholine, and pass on this impulse, this electrical impulse that is going to end up stimulating a certain action in an effector organ. So the receptors that will respond to epinephrine are your alpha 1s and alpha 2s. That's all we're going to talk about, those two. And your beta 1s and beta 2s. Right? There are beta 3s and alpha 3s, but we're not going to talk about those. So your beta 1s and beta 2s. Right? Those are the neuroreceptors that will accept epinephrine and pass on an impulse. And I'll talk a little bit about which ones. Right? Different ones are formed or in different organs. And you do have over here, I'm not going to break these down because I don't want to get that deep into things. So, but over here in the acetylcholine for the parasympathetics, you have muscarinic receptors and nicotinic receptors, right? And they break down into ones and twos and stuff. I'm just going to talk about cholinergic receptors, right? It's another thing that brings up another word, a couple words here. Adrenergic receptors and cholinergic receptors. Adrenergic receptors for epinephrine, well, they receive epinephrine, right? I didn't bring that up. And cholinergic receptors receive acetylcholine, right? So when we're talking about cholinergic receptors, blocking cholinergic receptors, that means that we are blocking the parasympathetics, right? When we are talking about blocking the adrenergic receptors, that means we are blocking the sympathetics. When we are talking about stimulating, or we use the words agonists, when we're talking about using an agonist, that means that we are stimulating a cholinergic receptor, we're stimulating the parasympathetics. When we're talking about stimulating adrenergic receptors, we're talking about stimulating the sympathetic nervous system. Right? So, and now, why is it important to know, and I'm bringing these up because it's going to be a great way to give you an example of why it is important to know that there's these different receptors, and it's important to know that these receptors are part of the sympathetic nervous system. The sympathetic nervous system uses receptors that will respond to epinephrine. These receptors will all respond to epinephrine, but the receptors have slight differences in them, which is kind of interesting, right? They respond to epinephrine. Now, alpha receptors respond actually better to norepinephrine, but I'm not getting into that. But these guys respond to epinephrine, but they're a little bit different. So what we've found, right? Let's say that this here is a receptor, and adrenaline comes along, and boom, and it comes up here and it bonds to it, right? That stimulates this receptor. Or maybe it comes in here instead of bonding like that. Maybe beta 2, it might bond like this. Boom. Right? Beta 1 and beta 2. So it bonds a little differently, but it's still the same neurotransmitter that's stimulating both of these receptors, right? So they're all adrenergic receptors. But we've noticed the slight differences. We've found the slight differences in the laboratories. And so we've learned that we can stimulate one without stimulating the other. That's a huge benefit,